Hello, I'm Dr. Jason Lowry, and so what I have here is a model of a hip replacement. The muscles in front of the hip are important from the standpoint of offering a nice interval that we can go between those muscles versus taking them off the side of the bone, which is the traditional method. With that, it allows for a quicker recovery. The other benefit is just from a technical standpoint, when I put these implants in from the front of the hip versus the side or the back, we were able to put them in more accurately because the patient, is laying flat. And we utilize both a robotic system as well as a fluoroscopy unit, which means a portable x-ray. That allows me to have real time right then and there during the surgery to know that those implants are in perfectly, they're sized appropriately, they're positioned appropriately, and everything is matched to your other hip. All of these things collectively account for an increased patient satisfaction and a shortened recovery time. So if you're having hip problems, come see me at our Arlington, Mansfield, or Midlothian locations.